Oli Health Center 4, in collaboration with Arua Regional Referral Hospital with funding from Surgical Center Smile Train, Good Samaritan Village Helpers Limited organized a 3-day free cleft lip surgical health camp, focusing specifically on providing surgical operations, rehabilitation, and treatment of children with cleft lip and cleft palate. One of the family beneficiaries from Adofolo village in Arua City, whose newborn is affected with cleft lip, thanked the organizers of the free cleft lip surgical camp for bringing the services closer to the people.
What has happened? It is all God's making, and there is nothing wrong we think about it. We thank the Lord for bringing medical personnel for coming to our rescue. We had the information over the radio, and that is how we got to know about the medical camp at the hospital.
At the time of giving birth to this child, my wife was all crying, and I told her not to cry because these are worldly issues and they do exist. I urged her to take heart, and for a child to be born without mouth, this is not a problem. God is above all. And I also urged her to pray and seek for God's request, which will be granted. These worldly issues affect everybody, and if at all there's anybody out there going through the same conditions, let them take heart.
Sister Dr. Nyajuka Justin Alisi Lillian, a plastic surgeon of Little Sister of St. Francis, is calling upon the government of Uganda through the Ministry of Health to give a vote to congenital abnormalities that need surgeries through promoting capacity building of the surgeons to address this gap.
You know, in Africa at least, especially, a deformed child in a family is always comes with a lot. The stigma, the embarrassment, the blame game. It was you, no, it wasn't me, it was the other. And then the African traditions around it. So our aim is to reduce this on especially the families and the community, and to educate the community that there's hope beyond any deformed child, especially a cleft lip, a cleft palate child. Here, this particular time around, we have about 45 patients who are lined up for us, and we don't leave a center until all the work is done. So supposing another 45 landed on top of these 45, we would still remain around until the last patient is operated. From here, we shall go to Chiriandongo. There are also about 20 patients waiting for us. Then we shall go to Kakomiro, Kakindo in Hoima. We have another 30 patients waiting for us. So at the end of the day, we shall have run around, done a circuit of about a week and a half, and with an impact of about 100 patients that are operated. But remember, we don't only do operations, we also do health education, family counseling, especially the mothers. So on this note, I call upon my government, my Minister of Health, to please think about giving a vote to congenital abnormalities, those that need surgery, that they can be done. Because remember, I come from Barara, I come from Kampala. Now, supposing I had to tell patients to find me either in Barara or Kampala, that distance. And even me traveling from Barara, Kampala to here, it takes me a whole 12 hours. So we are calling on the government to train more of us so that slowly, at least per region, per a referral diameter, there is a reconstructive plastic surgeon.
Surgical Center Smile Train, through Good Samaritan Village Helpers Limited, is focusing on creating awareness, mobilizing and educating people from the grassroots areas, specifically on cleft lip and cleft palate rehabilitation and treatment. This free cleft lip surgical health camp will run from the 18th to the 19th of March 2024 at Oli Health Center 4 in Arua City. Okumaringa Christine, for West Nile Television, Nilecast.